As we get started, just to note, and I'll mention this in just a moment, if you have any technical issues, you can use the chat function on your Zoom screen, and we'll try our best to troubleshoot those. We are going to have time for Q&A as well. We'll use the Q&A section for that. I'm going to go ahead and get started now. Hello, everyone. I'm David Shapiro, Program Manager of HealthLinks. We are a mentoring program that champions health and safety at work. We offer evidence-based healthy workplace certification and advising to help organizations and their team members achieve total worker health, which is the integration of health and safety. And we've had the honor of hosting 9 town hall meetings to date, and we've been really overwhelmed by the response from all of you, our participants, and all of the thoughtful and encouraging questions and comments you've had and shared with us over the past few months. So thank you for being here today and for participating in this town hall series. Today is our 10th Town Hall webcast in our series dedicated to providing you with trustworthy information during these challenging times. And today we're going to talk about reopening your organization through COVID-19. We're sharing information today from Energize Colorado, a project of the Colorado Nonprofit Development Center. And specifically, we're going to talk about plans to reopen businesses and organizations. As we begin return to work, or as some of you may have been continuing to work through COVID-19, reopening businesses throughout Colorado and our country, it's really important to have a plan for addressing the health and safety needs and concerns of employees and the public. This is now more important than ever. We host town hall meetings to provide you with tips and resources to support both yourself and your teams. And we're committed to the health, safety, and well-being of workers in the workplace. While all of us are facing the challenges of COVID-19 together, we do realize that each one of us are facing them in our own unique ways based on our own organizations and the obstacles we face. So we know that we're stronger together when we focus on public health and when we support one another through resources and information sharing. HealthLinks, as I mentioned, is a mentoring program. We champion health and safety at work. And we are part of the Center for Health, Work, and Environment at the Colorado School of Public Health. Our experience as researchers informs everything that we do. And our center, the Center for Health, Work, and Environment, is one of 6 centers of excellence for total worker health, funded by NIOSH, the National Institute for Occupational Safety and Health, at the CDC, the Centers for Disease Control and Prevention. A little bit of housekeeping about today's webinar town hall meeting. All of our participants are on mute today throughout the duration of the presentation. We want you to use the chat function in your Zoom toolbar for any technical issues you're experiencing. And if you have questions for myself or for our presenter, please use the Q&A box in the control panel of that same screen, of the Zoom screen. Our webinar is being recorded today, and so we will share the recorded content with you in our follow-up email tomorrow. As well as the slide presentation from our presenters. So you will get the recorded content, both the presentation itself, as well as the webinar recording in a follow-up email. And I'll mention this again later on, but there will be a brief survey at the end of our webinar. We ask you to just take a few minutes to complete that. Your information and feedback is really important to us as we continue our town hall series and plan for our webinar series in the future. Our overview today, we are going to have, as far as our agenda, our presentation, and then we will open it up for the Q&A. Once again, you'll use the Q&A box in the control panel of your screen for specific questions for for reopening your organization for our presenters. We are going to share a template with you throughout the presentation, so if specific questions come up while we're reviewing the template, please put them in the Q&A box. Before we introduce our speaker, I just want to talk a little bit about disaster preparedness and emergency planning. Continuity planning and disaster preparedness have been at the forefront of conversations for our community and for employers since February. What we've witnessed at the HealthLinks network and among our Healthy Workplace network is that organizations who focused on employee safety and had strong emergency response plans in place prior to COVID-19 have felt more prepared to respond to today's challenges. Clearly, the risk has been identified. Public health authorities like the World Health Organization and the Centers for Disease Control and Prevention, along with public health officials and experts, have all weighed in to discuss the risk and identify the risk presented by COVID-19. Today, we're going to be talking about having a plan for reopening your business or organization. As you'll hear from our presenter, we're working on while working on your plan, there are action steps we'd like you to consider when drafting and improving your plan. And our presenter will talk about these components as well. But first, we want you to think about who should participate in developing the plan, and try to include as many coworkers from different levels in your organization in the planning phase as possible. Focus on people who are vital to the daily functions of your organization. You've probably already been doing this over the last few months, and include individuals with technical expertise, managers, and executives, especially employees with special needs who may have unique requirements as well. Ensure that the people responsible for implementing the plan know what they're supposed to do, and it's important to cross-train others to provide backup support as well. Meet with other businesses in your building or industrial complex to share your plan and collaborate. This is the idea of being a leader in your community and where you operate. Communicate your plan with employees, potentially conduct practice drills, and talk with your vendors, utility providers, and first responders. Plan with your suppliers, shippers, and other business associates. While we understand there's this real sense of urgency right now, it's important to review your plan periodically and update it as new information becomes available from public health and as you face new and unexpected challenges. Lastly, we want to acknowledge that this can be really difficult and requires challenging conversations. You may be asked to provide support in areas you feel unprepared for. At HealthLinks, we're here to support you when you're ready. At the end of today's town hall and as part of our follow-up, we'll provide additional information about COVID-19 advising sessions that we've been having to help you respond to questions from leadership or to walk through your plans, and additional resources that we have available to help support you and our team and your team. With that, we want to introduce our presenter today. We're honored and grateful to have David Secunda, the founder and CEO of Workbright, an HR technology company that provides digital remote onboarding for new and returning workers. David has led numerous organizations. He's really a truly entrepreneur in our community, and he's representing Energize Colorado today and their Reopening Colorado initiative. Dave has founded organizations including Avid for Adventure, where he's founder and chairman, Planet Outdoors, and was the former president of the Outdoor Industry Association. He's also worked as entrepreneur in residence for a number of venture capital and venture partnership firms. He's an active mentor in the business community through the CU Lead School of Business, and has served in boards of Entrepreneurs Organization Colorado, RMC Health, the American Camp Association, was a founding board member of Leave No Trace. Additionally, David was the chairman of the Colorado Department of Human Services Licensing Advisory Committee for Child Care Facilities for the 6 years. And today he's going to really be talking to us about Energize Colorado, this initiative, and reopening plans for your organization and templates. So with that, I'm going to turn things over to David Secunda. Thanks, David.
Wow. I feel, thank you for that introduction. Boy, I hope I can live up to that history. I have a lot of information for you all today, and I'm going to try and really focus the comments that I have here for you over the next 20 to 25 minutes so that we have plenty of time for Q&A at the end. You know, as David introduced me, it's kind of a double-edged sword that I'm with you here today. You know, I'm so pleased to be able to bring you information that Energize Colorado has put together. I've been volunteering there to help your business reopen, but it's also with sadness that it exists under the circumstances of pandemic. My company, one of my companies, Avid for Adventure, we had to immediately do a 20% layoff, a 30% comp reduction. We're down to 20% of our annual operations. So it's kind of with a real personal understanding of unfortunately being in the trenches, dealing with the difficulties of reopening, that I bring you this information today. My other company, Workbright, it's also, you know, apropos that for years we've been focused on remote onboarding of employees, and now all of a sudden this is not just a logistic nicety, but a imperative for us when we're looking at bringing employees back without putting folks in the same room altogether. So with all of that being said, I want to go ahead and jump in on the content side so that we can really walk through the things that I have for you today. The first thing is to orient you to Energize Colorado and what it is and what the resources are that you can find at the Energize Colorado site. So the governor spun up the Emergency Council on Economic Stability as a policy recommending entity of business leaders. Quickly, those leaders recognized the fact that there was a lot more to be done in Colorado than just policy recommendations. And so we spun up a nonprofit, a C3 called Energize Colorado, that is truly focused on the economic vitality of businesses in the state. The different things that are available there right now, and if you go to energizecolorado.com, you can pull these things down. PPE, it was a clear fact that it was difficult for businesses to get protective equipment for their employees and their customers. We have a PPE program at cost for any Colorado-based companies where you can order PPE. The ones that I ordered for the office here arrived the very next day, everything from hand sanitizer to N95 masks. There's also a very robust mentorship program where if you're similar to the services available through David and his program, this will link businesses with mentors who can help navigate the difficulties of the economic downturn. There's a gap fund. This is rolling out in early, probably in the next 2 weeks. And this is focused on businesses that could not get the PPP or did not get the PPP, either because they didn't have a banking relationship or it wasn't the right fit for them. This is a significant program that is coming very, very soon. There's a huge mental health initiative. There's over 500 hours of counseling time that has been donated to Energize Colorado to match with those in need at no cost. There's a free year of headspace available to anybody who's been negatively impacted in the state by COVID-19. So lots of resources there. And then finally, the Reopening Colorado resources. And that's really what I'm going to focus on today, are the things that you can find on the site that are going to help you tactically move through the process of reopening your business. So with that, I want to pause for a second and ask Katie to bring up a quick poll to kind of understand where you are at today. Like, is your business open at full capacity? Is it open with limited capacity? Or is it not open at all? So go ahead and take a moment and go ahead and vote on that right now so we can take a look and see where people are at.
We've got a lot of responses coming in, so I'm just going to give it a minute.
Okay.
All right, looks like it's starting to slow down. I'll go ahead and share these results. David, can you see the results?
I can. So the vast majority opened with limited capacity, about 70% of the folks at the call. And that is definitely where I'm falling in right now as well. So I'll try and really target remarks to those who are in that limited or no capacity in particular. Thanks for that. That's helpful to see where we're at. So basically, the idea of reopening, when we talk to businesses, what we heard is, please do not send me another 60-page PDF that I have to weed through to figure out how to open my office. Make this as simple as possible. So we've broken down the reopening process into 4 parts. Let's keep COVID out. Let's not pass it along. Let's plan for what to do when it does happen, and let's care for our people. And that is really the organizational structure that you're going to see within the Energize Colorado site. I want to take you to the site for a second just to see what resources are there. When you go to Energize Colorado, this is under the Reopen Your Business tab. And you'll see down on the bottom here, there is a reopening planning template. And that is really where to kind of begin this process. When you focus down, you'll find 2 documents that either a Google Doc or a Word document, same thing, that are ready for you to download and just dig into as a company. Once you download that, you're going to get a big picture of these 4 chapters, the 4 chapters that we just talked about. And then it will start to walk you through each of the sections. And I will revisit this as I go into a little bit more detail in a moment. It'll give you a description of under the heading, like let's keep COVID-19 out, of one of the things you need to do, screening, and things to think about, as well as links to find that information for your business. And so it'll walk through each of these areas, and I'm just doing a high-level pass-through right now. There are many more pages, but this allows you to both put in a plan for the current phase, so for example, those businesses that are partially open, and a plan for the potential next phase. So right now we're in the safer at home phase. What is your opening plan in the next phase? That's just a notes section for you as well. What to do when it does happen, and caring for our people. So once again, we'll walk through these sections in greater detail in just a moment. Another thing that's available on the website is the customizable template. So once you go through and pull down the template and answer the questions, go through kind of this interview sort of process to write the plan for your company, it is likely that you want to drop it into a template that's going to allow you to personalize it. And this is using it for Workbright. So once I wrote the plan in the template, then I took the content and dropped it into the customized template with our logo and everything else. This way I can share it with employees, board members, customers, and it is branded for my company, and that resource is there as well. Additionally, on the website, you're going to see links for things like signage and screening guides. And this will bring you, this is the signage template. It has links on the first slide to many, many, many resources to grab the appropriate signage for your business, and then gives you either a PowerPoint or a slides deck to drop those signs in so you can print them and laminate them all for your business. So this is an example of ones that a business might choose, but you can proceed on any of those that are relevant to your business. And then finally, there's a visitor and worker screening template that was made in Google Forms, which is HIPAA compliant. And again, this is something that you can use so that you don't have to use pen and paper for people going through a daily screening process when employees are coming in. So that is a, whoops, let me go back one here. That's kind of a quick high-level overview there. I want to encourage you as you go through this, or as I walk through this, to write your questions in as they come up. I want to try and get to as many of them as possible as we go through this process. And so what I'm going to do next is jump into the actual template itself. And this is what you would download. So as I walk through these sections, I'm going to try and give you some detail, but if you have other detailed questions, let's try and hit them in the Q&A as we go through this, because there's lots and lots to talk about here. So once again, the big picture is allowing yourself to simplify, to think about these 4 different chapters: keeping it out, not passing it along, planning for when it inevitably will happen, and I just emphasize that, and caring for our people, the most critical resource for all of us here. So keeping COVID out. So let's start with this, screening. Screening is one of the most important things we can do as businesses to try and prevent the virus from coming into the workplace itself. When we're talking about screening, there are a few W questions to ask and an H question as well. First of all, what is the screening itself? So at a high level, and once again, the template is in the materials online. At a high level, you're asking your employees and potentially folks who are delivering or customers as well, if they have had any of these symptoms, the COVID-19 symptoms, or if they've had a temperature of 100.4 or higher. And if any of those answers are yes, you're asking people to not come into the workplace or stop at the door and not proceed. So that's kind of the what. The where is an important one. So ideally, you don't want to have a screening process and I'm working in an office, I'm the only person here from my team, but you don't want to have your screening inside of the office where you're already inviting in the potential of that virus. You want to have it either outside or at the door or in a contained room. And anyone who is dealing with that screening, so at larger organizations where there's some volume, the how of it is typically a person will be assigned and they will have proper PPE, which is in this case considered to be a mask, potentially gloves, but just a mask at a minimum. And they're making sure that all employees go through the screening on the way in. Using the electronic screening process, it enables them to do it from their smartphone, either before they leave their house, which is even better, or at the door from the outside. And then that can be monitored as they come in. So screening is certainly a critical part of this, this initial portion of keeping COVID out. Another part of it is signage, is thinking about what sort of signage is necessary in order to let people know what these processes are. And like the minimum types of signage that you're going to see on businesses typically are going to be something about screening, meaning if employees are required to do a screening, you're going to see signage about that, and potentially signage that just lists the COVID symptoms and the fever and just says, if you have any of these, please don't enter this building, this space, this retail store, whatever it may be. And as many people, I've just concluded a 4-part series where we've talked to businesses about their concerns about these. And what we're really hearing is consumers want to see you taking the proper precautions and knowing they're coming into a safe space. So we're hearing less that it's off-putting. We'll talk a little bit more about that in the enforcement section of this, but really at a minimum, those types of signages. And then, you know, other things are talking about processes. So in a business format, we're still at the safer at home phase. At this point, it is not advised to have any unnecessary travel for your workers, and so to kind of move that off the table in order to not bring things back into the workplace. And no unnecessary visits as well, to just limit folks who are in and out of your physical workspace. That is a quick high level on the keeping it out. The big section is let's not pass it along. And this is where you hear all these conversations about physical distancing and that sort of thing. The important thing to think about before you drop into the physical configuration of your workplace is how you're gonna communicate what you are doing to both your employees and to your customers. And so, you know, for employees, it's not just having a physical setup, but it's employees kind of understanding why it's set up there, what the risks are, how things like hand washing and increased cleaning contribute to a safer workspace. So there's a lot of employee education that you need to think about. And this point here is where you kind of write that plan. There's also educating your visitors. There's a great blueprint from Kroger, if you Google a Kroger group blueprint, where they talk about the audio recordings that are playing in the Kroger markets here in Colorado, that's King Soopers and others, that orient visitors on the different things that they're taking as far as precautions and that visitors are requested to do as well. So educating those visitors. When we drop into the physical distancing, boy, that's where a lot of work can be done. And in general, the thing to keep in mind is when we talk about physical distancing, we're talking about keeping people at least 6 feet apart for those durations that are a minimum of 10 to 15 minutes and up, meaning those are the highest risk. Less than 6 feet, more than 15 minutes, that's where to focus initially on the areas of your workplace, the areas that could have those sorts of interactions. So things like removing additional chairs from break rooms so you don't encourage people to congregate together. You know, putting physical barriers between customers and workers so that if they're in one place for customer service for a long time, there's a physical barrier in between them. So that's the mental headspace. And then also to think about PPE for employees and potentially customers as well for those times when it's hard to keep that physical distancing and conduct business going forward as well. Enhanced cleaning is a huge part about what we can do to limit the risk of COVID-19. And enhanced cleaning is a little bit it can be a little bit misguided, okay? Because it's not really about just more vigorous cleaning. It's about cleaning and disinfecting with an approved disinfectant. And those are all listed in the template through the links there. Along with a very easy one, which you can make from diluting bleach with water into a spray solution. That's kind of the lowbrow method. There are tons of other cleaners or disinfectants, I should say, that are appropriate for those workplaces. But that enhanced cleaning, you're talking about the disinfection, which is very, very important. And you're talking about the cadence that cleaning takes place, especially in high-risk areas like restrooms. So just for example, at Workbright over here, we have a shared restroom in this office space, and that restroom has the disinfecting solution in it that each use of that restroom, the person is requested to spray down the touched surfaces in that room before they leave. We have an enhanced cleaning once a week, but it's just really increasing the cadence of those cleanings and disinfectings to get that job done. Other things to think about are operating hours, all of the different things that you need to do to adjust your operations. Hours can be ones that will reduce customer workflow or concentrate customer workflow when you have the resources on hand to deal with it. But you really want to think about how people move through your workspace and adjust your operations accordingly. That can be things like encouraging pickup instead of people browsing in a store, or encouraging delivery instead of having people come into the store. It can be limiting the number of customers in a store at one point in time. All of those things are just kind of the things that are necessary in adjusting your operations, and then communicating with your customers so they don't have a frustrating experience as well. Then there is a huge amount on food safety. This is an area that to many is familiar if you're working in the food safety arena, and it's just stepped up as far as the cadence of disinfection, etc. There are many useful resources that are linked into the template for you to really dig in if you do provide food services. But in general, the things are, if it's optional, maybe remove that. Many companies that have provided some food are, of course, kind of really limiting how they provide that and focusing on things that might be grab and go as opposed to family style service. Think about resident camps and all of these sorts of places that have had food services that really need to kind of rethink how that food is delivered there overall. So at a high level, food safety, most folks who are focused in that area for their business, this is just enhancing what you've already been doing and increasing the frequency there. And then the final part, and then I want to go to Q&A, so start launching those questions in there. I want to make sure that we're answering the very specific questions you have about your business in the reopening process. So please, right now, go ahead and put those in there. We'll get to them in just about a minute. I'm sorry, there's two more sections here. What do you do when it actually does happen? And I said this is an inevitability for businesses overall, that we are going to find that there is a COVID case in some way associated with the business. And when I say what does it mean when it happens, that doesn't just mean an employee calls and says that I have a confirmed COVID-19 case. It also means those that have symptoms but haven't been tested. They've been exposed to somebody, but they don't have symptoms and they haven't been tested. They've been requested to quarantine by a healthcare provider. They're at high risk due to medical conditions. They're immunocompromised. All these sorts of folks are falling into the what to do when it does happen category. So one of the pieces around this is to really prepare in advance so that you know what is available to employees. There are links to the current Colorado and the federal FMLA policies, the emergency ones that are in place for sick time and FMLA. I encourage you to look at those and use those as a minimum bar and see, kind of really what is available to employees and do your best to provide that to them. So it's not an economic decision that they're trying to make if one of these different circumstances comes up. The other part of what to do when it does happen is tracking, and that is really understanding if it has occurred in your workplace. Your responsibility as an employer focuses on those employees within the workplace, while at the same time guarding the privacy of the affected individual. So it's letting other employees know that there might be a confirmed case or a suspected, presumed positive case, not telling that person's name, but allowing those other employees to either get tested or self-quarantine or symptom monitor with vigilance in that period of time. And then interfacing with Department of Health in order to do larger contact tracing. And that will be looking at folks that this person is contacted outside of your business. Of course, you'll share the inside of your business side as well. But that's a whole level of tracking that the template will walk you through there. And then the final section here is just caring for our people. And this, again, is where we end, but it's really where all things begin. The physical support, we've talked about PPE for employees. That's certainly a critical part of that, but also understanding the financial support. We talked about the emergency policies for sick time and FMLA, both state and federal, but also we're seeing many companies spin up emergency funds. Avid Adventure, for example, spun up an emergency fund to serve employees who were affected, not necessarily just diagnosed, but those who had a financial need that was really around food, shelter, or medical. And these are just $250 to $500 grants that we made available to our 800 employees. And it's nothing that's required, but it's just like thinking about how to support those employees. And then another huge part of that is the mental health support and emotional support to provide to employees. And boy, we could do, and we just did a whole webinar on this. The thing to know as an employer on the mental health side of things is a situation such as COVID-19, it will amplify for employees whatever underlying instabilities or fears exist. So as an employer, you can see this amplification, the stepping up of things going on in your workforce. And it's something very much to be aware of. And then to really train your managers to both recognize what's going on with workers and to deal with all of these difficult situations between workers and customers and workers and workers. It does demand additional training and focus on the mental health capacities of your management team. And then to know the mental health resources. So if you do have something that is coming up, you want to be able to point people to the mental health resources in the state. Again, Energized Colorado is a good place to go with the counseling hours that are available there. There are mental health resources that are linked from the useful resources in the template, but really not to just have an empty hand when you do notice a mental health issue moving forward. And then finally, the last thing I'll touch on here is the recognition of employees. This is a time when people are they're stressed. There's a level of anxiety that comes up. There's a level of work that is increased just to deal with all of these new precautions, and that takes its toll. And so as an employer, it's critically important now more than ever to recognize those employees that are making those efforts. And that can be as little as just words of support. I see you. I see that job that you did with the customer. I saw you deal with that difficult situation. Well done. How can I be of support? Those sorts of things are more important than ever. Employers we're seeing make a variety of efforts here with things like even providing little gift certificates and gift cards as points of acknowledgement, calling employees out on their social media, acknowledging them in virtual staff meetings. All these sorts of things are just so important in order to keep your employees aware that you see them and you really are caring for them overall. So with all of that being said, I am going to, actually let me go back over to this other screen here. No, I think we can just go right over to some Q&A. I might share a screen with some additional resources in a minute, but let's go ahead and jump in there.
Thanks so much, David. Really appreciate you walking through these really practical resources that Energize Colorado is putting together and your own experience as an employer. As David mentioned, we are going to be monitoring the Q&A box. So we've already gotten a number of questions in there, and we will continue to try and respond to them as best we can over the next 15 or 20 minutes. One question I had at the opening is, from your experience, who's working on building these plans within an organization? I know you've run some small businesses. You also have, Avid, which is a larger company. What types of individuals are working on the reopening plan, and how are you communicating the plan to your team?
Yeah, absolutely. So, at small businesses, quite frankly, it is usually the owner or founder or leader of the company that this falls to. As companies grow in size, it is very important to involve functional leaders, not only so you have the expertise in the plan that is relevant to each of these sections operationally, but even more importantly, so you have buy-in, and it goes to this point of recognition and involvement of employees. So it's critically important to involve functional leaders within an organization. The how to communicate it, boy, I've seen a whole variety from we're doing a virtual meeting where we run through these things to we're recording policies and procedures and you can watch them at your leisure, to we're having you sign new HR policies and procedures, to we're grouping up in a social distanced arena to talk about these various things. So it really isn't as important how you communicate to employees, it's that you do communicate to employees and check their learning to make sure that they do have good comprehension around this.
Great. Thanks, David. Just a reminder again to folks that we are going to share the template. We have a health links checklist that we've come up with. So as a follow-up email from today's presentation, we're going to share Energize Colorado's template, one that we've created as a brief checklist, and the recording of today's presentation as well.
And in that one as well, Dave, I'll include for you some links. Workbright is now, for any companies that are less than 30 hires a year that have been negatively impacted by COVID, we're doing free use of Workbright in your rehiring so that you can do that remotely. There's also, we'll give you some links to some of the things within Energized Colorado to add into that. So I'll hand that over to you after this so you can get that out to folks as well.
Great. A couple questions have come up about employee behavior and employee compliance, and I wonder if this has come up with the organization you've worked with. So one person is saying that they've witnessed, they've gone into businesses where while customers are around, people are wearing their masks, doing the physical distancing, but when customers leave, the employees are not necessarily complying with those. So that's one question that came up. Just curious if you've heard of this going on either in restaurants or in other areas where outwardly to the public, people are displaying these behaviors, but having a harder time with it internally.
Absolutely. So let me actually, before I hit the other side of this question, which is what about your patrons, your customers, and their compliance on these sorts of issues? And we did just do a whole webinar on that particular topic because it's even more difficult with the customer base. And basically best practices out there right now are to be clear on your requests, but in general, it is absolutely your option as a business to refuse service or to keep customers out if they're not wearing a mask. By and large, what I'm hearing is that there is a request made, but then there is a distancing that is taking place if a customer does not comply with that overall, but no kind of, let's hop in and do an enforcement here. One company that is a consumer-based company, actually, they have somebody kind of shadow somebody who is non-compliant in their store, and literally they'll go around and do some enhanced cleaning after that person and just really try to kind of mark their way through the business, which is interesting. It's just another way of dealing with this. On the employee front, so I have heard this. I've heard this especially around social gathering areas, and in the restaurant industry in particular. Many industries, people work for money, but they also work for the social interaction. And so the 6-foot distance thing, it's difficult physically, but it's also difficult emotionally and socially. And so businesses are talking about these areas of typical, server congregation where they have these side conversations. where there are those areas of non-compliance, I'll just say. And so the things that I've heard as far as best practices are really focusing on those areas that make the biggest difference and focusing in on education and signage. And the thing that I think is interesting to come back to, and this is hearing from both a infectious disease physician that was on our webinar and also somebody from Boulder County Health, is really this focus on these interactions that are less than 6 feet apart and 10 or more minutes. And that's your highest priority to remove those situations. Those situations are unfortunate and those that we don't want when people pass each other not wearing masks, but much, much lower risk. And even surface contamination is, of course, a hazard, but lower risk than 2 people face-to-face for that amount of time. So really focus your resources, focus your education, and decide when to use the heavy-handed aspect of being an employer that can actually require this. Like, it is your prerogative. For those folks who are working there, you can basically say, this is a work requirement right now. You need to do this. In the same way that in the past, as an employer, it was not an okay question to ask, do you have a fever of 100.4 or above? Have you had these symptoms today? It was just like off the table. In this time of pandemic, it is both legally and ethically appropriate and important to ask these sorts of questions. And you're very much protected as an employer. You do have risk if you're not keeping those records confidential or you're being cavalier with that information. But this is all new territory for folks who are managing employee workforces.
I appreciate you bring up the health screening question, because we've had a number of questions come in through the Q&A about that particular activity. One being, who at the organization is performing that function in your case? Or once again, I'm sure it varies based on the size of the employer, but a question came up from an individual about who should be doing the health screening.
Yeah, so I'll just give you a few examples. Here in this physical office, where again, I'm the only one working here, our typical capacity is in this office about 18. So we're actually limiting, no more than 6 people could be here if we were allowing that. For this organization, people do it remotely on the Google form before they come in from home, and I get an email notification anytime somebody fills that out. And it's also filled out by our cleaning crew. And anybody who is going to enter the premises for delivery, there's just a sign on the door that says, please visit tinyurl / our address. You go there and these questions, they put them in, and it'll either give you, thank you for doing this, come on in, or please do not enter. So this one, in this size of an operation, not monitored. We also had the Academy, a senior living facility, on last week on a webinar. Obviously high consequence on the screening side of things. And they have it is rotated through, it is staffed at it's a kind of an entry foray area, and it rotates through different folks scheduled in the organization, from the executive director to the person who works reception, all in these 2 to 3 hour increments. And they're doing screening for anyone who comes in, staff member, delivery, whatever it may be. And once again, they're wearing a mask and they're managing that interaction. So I think it's really dependent on the organization and operationally what makes sense. I guess the final thing I'll say is that organizations that have kind of required close contact, that screening is all that more important. So think childcare, for example. In childcare, it probably is not enough to have people self-reporting before they come in. Of course, it's fine to ask those questions, but best practice in childcare is that those temperatures are taken of those kids as they arrive every single day by a staff member, and that information is being recorded, and that there's a request that only one parent bring them, and it be that same parent to pick them up each time, to limit those exposures, because there is that duration of focus there. A lot of requirements around childcare. I don't know if there are any folks on the line right now. I'm sure you're aware of these maximum group of 10 plus the folks who are caring for them, lots of enhanced cleaning requirements as well.
Thanks, David. I mean, I think this question keeps coming up about what to do if employees are not compliant, if they're not willing to fill out the form. What we've heard is, what if they're self-reporting and not actually disclosing what's going on? So, yeah. I mean, I think we've been talking about personal responsibility a lot through the few months of these webinar series, through our series and through these town hall meetings. Is there any other guidance? I mean, and you also talked about, as an employer, sort of requiring your employees to be compliant with these activities and being honest and truthful. But I'm just curious if other people have strategized.
Yeah, so there's a few different aspects of this. One, this is management 101. We happen to be talking about a time of pandemic, but this is also like people smoking in the break room or whatever it may be, that you need to pull out your management resources in this time and really use them in that laser focused area on those precise areas that are most important, most high risk. Start there and expand from there. But what we've heard as far as a best practice, specifically around non-compliance in communication, meaning I have these symptoms, but I really need the money. The most important thing we're hearing as far as best practices is to pre-communicate to employees what is available to them if they do show these symptoms or they have been with somebody who is positive. And that is the biggest thing you can do as an employer, is not wait until somebody might tell you that, but in advance, as part of this employee education, say, if you have to care for somebody with COVID-19, if you are having these symptoms, if you are living with somebody with COVID-19, this is what is available to you right now, and this is how it will take place. And in this current situation, the economics they're not as good 100% at a requirement level as coming into work, but they're pretty good right now, and those will probably be extended. And I would encourage, again, best practices I'm seeing from employers is, if you want to keep COVID out of your workplace, you are leaning in on sick time benefits to allow folks not to have to make an economic life or death decision as far as whether they work or not.
I'm glad you brought that up. And it sounds like, and we've also seen organizations, you brought up the example of extra benefits that you've instituted in your workplaces for Avid. We've seen that with other organizations as well, that they're really looking closely at their paid time off policies, at their sick leave policies, at their their flexibility policies. So we've been doing a lot of communication and work with organizations that this is the time to, as you said, pre-communicate with employees, let them know what is available to them so they don't feel the pressure of not being compliant with their reporting. Like we need people to be to disclose when they're having these symptoms, and the best way to do that is to carefully review your benefits, your PTO policy and sick time, and clearly let people know how they can access those. I agree with you on that. Yeah, go ahead, Dave.
There's another one here, which is, I saw this question somebody was asking just about what employees do on their free time, and how you deal with that, because this is another part of screening. It is, it's like an STD. It's like they're bringing with them everything they're doing outside of that workplace to the current situation there. And again, this is just really where education comes in. In some businesses, I'm seeing with, for example, high-risk populations they're dealing with, they're requesting either a negative COVID test or a 2-week self-quarantine before going into work. It's a request. It's like, can employees lie about it? Absolutely, they can. But this is part of that education piece overall. And it's also part of the compensation side of it. Like if you're asking employees not to travel on their own or those sorts of things, it's hard. It's you got to kind of get into employee mindset and just think about all the moving pieces for them in general in influencing their decisions of where they're going to work, when they're going to work. And I will just say another really, for an employer, a difficult thing right now is how good unemployment is, And so you're looking at supercharged unemployment, minimum $625 per week in the state of Colorado right now. That means that the kind of hourly workers at the lower end of the pay scale, it is probably more economically beneficial for them to take unemployment than to come into a workplace, potentially expose themselves to COVID-19. And so as an employer, you just need to keep that in mind overall, that these folks you're requesting to work, especially those essential workers, you really got to think about what we're doing for them. And I would say it should ideally step up above what they would get if they are not working at all.
Thank you, David. I want to just mention that we had some folks chime in, including our partners at the Colorado Safety Association, who have heard a little bit from legal about being cautious about collecting medical information. So the types of questions you might want to ask is, are you experiencing a temperature of 100.4 or over? Yes, no, rather than having them describe, put in the temperature, or, if you're taking the temperature, marking a yes, no checkbox saying they screened over or under that temperature, rather than getting into some medical compliance issues with the actual temperature.
Absolutely. And if you go to that template, in Energized Colorado, it's going to be set up that way. What I will say, though, there was an interesting question on the call on the other end of this, on the webinar we did last week, which is, what is the liability of an employer if you do not screen, if you're not doing this well, as opposed to if you're asking too detailed a medical question? And truly, there is liability on that side, as well as not doing your diligence to create a safe workspace for your employees. And so what we had a partner in HR law from Cooley on the call last week, and basically she said there is a huge amount of latitude right now in the world of HR in the time of pandemic. And of course, you want to guard privacy as much as possible. You want to keep these records separate from those that are HR records. You don't want them to influence anyone in a hiring decision, for example. You want to sequester these kind of health-related records separately. But if you're doing that, it's probably just more important. Don't worry about, do I get the question exactly right? It's more important to do your screening. Gosh, do your darndest on it. It's probably the most important thing you can do as an employer.
Thanks, David. Appreciate that. Clear communication is really important at these times, as we know. And just wanted to say also, of course, if there is a confirmed case at the workplace, contacting your public health agency, of course, sending the employee home, but then working with your local public health agency when a case does come up, making sure it's reported. And when there's more than one case, if it were two or more, I don't know if this has been talked about, but figuring out how you're going to alter operations and potentially even close if more than two cases or if more than one case is in the workplace within a 14-day period. Has that come up on your
It
call?
has, and quite frankly, the thing to know about public health is they're really good at contact tracing. This is kind of what they do outside of this pandemic as well. And so you're going to get a lot of support and advice if all of a sudden you have more than one case in your workplace in that period of time. They'll be talking to you.
Yeah. Just want to mention one other comment that came up, that there is someone who's weighed in that said that they've actually modified their policies and procedures requiring employees to fill out this form and following the return to work protocols. That's been the case at the University of Colorado at the Anschutz Medical Campus as well. There are requirements in place for the steps that need to happen in order for someone to come back into the office. They include, or come back onto the campus. They include a training that people are going to take, going through a health screening checkpoint, getting approval from their supervisor. Obviously, we're a large organization, a large campus, and so it's a requirement now for employees to walk through those steps before coming back onto campus.
Yeah, and I did see some questions about larger organizations, and this kind of goes back to Management 101, the question of enforcement versus education. And I always am going to be one to say, lean in heavy on education, try and enroll your employees to kind of understand the consequences, make it very real, tell stories, just for example, my daughter lives in New York. Her and her boyfriend moved into our house here in Colorado. For many of us in Colorado, this idea of Corona is kind of abstract. It's like, do I know someone with Corona? My daughter's teaching remotely, and in her cohort of 13 students, 3 of them out of 13 have had direct family members pass in the last month and a half. And I don't mean this is like mother, father, sister, brother. And so, being able to kind of make it real and allow employees to get their arms around the true consequences here, even though it's something we can't see, it's not as tangible as we want it to be. It's kind of our job as leaders. I guess the last thing I'll say on that is leading from the top, absolutely of critical importance. Like, you want your employees to be doing something, we have to see leadership at the top.
Thank you so much, Dave. Really appreciate you being part of the town hall series today. I'm going to wrap up with a few slides. I know that we didn't get a chance to get to everybody's questions today. That's always the case, but you know, there's an opportunity to continue learning from our town hall series, and also to pose your questions as they come up to our team as well through the email that is going to go out tomorrow as follow-up. Want to talk to you about our next town hall webinar on Monday, June 8th at 11 a.m. We are going to have our partners from Pinnacle Assurance. We've been working with Pinnacle since our inception, really, of the program very closely. But we're going to be working with talking with the legal team as well as the safety team. So Harvey Flewelling, who's Associate General Counsel and Appeals Counsel at Pinnacle Assurance, and John Cromer, their Safety Services Supervisor, to talk about the legal and safety implications specifically through COVID-19 and return to work. Experts in safety and legal counsel will be discussing what you should know to safely resume work after pandemic closures, know what to do if your employee gets the virus, and understand whether employees could claim workers' compensation insurance claims for that as well. So this important presentation will help us all with information we need to know as we return to the workplace or continue on the next phase of our response to COVID-19. We will be sending an invite for this town hall meeting as part of the follow-up email as well. I mentioned earlier when we opened that we are offering free advising sessions to employers. These are some of the topic areas that we have experience in based on our team of advisors at the Center for Health, Work, and Environment. If you want to check in with us about health and safety compliance or how to get PPE, thank you, Dave, and to Energize Colorado for providing additional resources to Colorado businesses on how to quickly get PPE. We will share those links with you as well. Return to work guidelines, like we talked about today, having a plan and how to navigate some of the challenging questions that come up on a return to work plan. We've done work on total worker health and total worker health leadership for several years. We have an executive program and other resources available to talk about how leaders can really walk the talk here to instill what we hope both employees and the public take on as important measures. So these are some of the areas, including and also mental health and well-being, which got addressed. I know at the end there, Dave brought up his daughter's experience and the tangible aspects of some people and how they're coping with people that they know or even getting the COVID-19 or coronavirus themselves. There's a real mental health aspect to this. It's a physical disease, a physical virus, but the ways it's impacting all of our mental health and the ways that moving to remote work and has come back. So this is another topic area that we've worked a lot with employers on how they can focus on access to employee assistance programs or creating virtual teams where people can check in with one another about mental health. Please stay connected to us. In order to access the free advising session, it will be mentioned in the follow-up email, but you can also send a general email to contact@healthlinkcertified.org. Our social media profiles you can find on our website, but also are here listed on the screen for you. We're at HealthLink Certified at LinkedIn and then Facebook, HealthLinks News at Twitter. And as you're exiting today, for the participants that are still with us and have hung on for the full hour, thank you so much. Please take a few minutes to complete the feedback survey. We have been getting just great questions and opportunities to engage with you based on the information you're sharing in this feedback. So please take a few minutes before you move on to your next work appointment or whatever is pulling you into the rest of your work and personal lives this afternoon. Take a few minutes to complete the feedback survey. It helps inform our town hall series and our continued webinar. Want to thank you again, David, for participating with us today, and thank all of you for joining us on today's town hall.